If you are thinking of a bank that takes care of customers' needs by providing quality services with flexibility, reliability, and innovation, think Trust Bank Limited. With Trust Bank Limited mobile banking, you enjoy services such as balance inquiry, mini statement, funds transfer between accounts, exchange rates, mobile airtime top-up, stop ATM card, checkbook request, and PIN change. Our real-time gross settlement allows the customer to instruct the bank to transfer funds from their account to another account at another bank. Our expertise and experience in international banking is both legendary and the envy of the market. Retail banking, one bank, different amazing packages. Whether you are interested in savings account, current account, time or fixed deposit account, lending or overdraft, our team of dedicated staff is always ready and willing to help you out with your transactions as you wish. Corporate banking. Trust Bank Limited offer the most convenient services for deposit accounts, credit facilities, trade finance, bond and guarantee, and foreign currency account. With e-banking, you can make electronic bill payments and online banking and enjoy 24-hour access to your cash with our ATM. With the largest network of branches and agents, we give you the convenience to receive funds as you please. Trust Bank Limited, proudly Gambian.
fay lempo warugal la ci képp koo xam ne doomi réew mi nga ak ñu fi dëkk bu fekkee ne ci at mi sa koom-koom weesu na $24,000 dalasi mbete weer bu nekk di nga am lu tollu ci $2,000 dalasi lempo si la nguur gi di sukkandeku ngir liggéey yokkute réew mi GRA mooy banxaas bu nguuri Gambia sas ngir mu fayeku lépp luy lempo ci biir réew mi ba tax na GRA di yëgal faykati lempo yi ne warugal la pour ñu fay lu ñu naan withholding tax on contract payment maanaam bépp contract bu waay joxe te ci biir réew mi lañu toog kon xaalis ci contract bi ngeen nangotoo war nga cee wàññi ci xayma téeméer bu nekk fukka bu fekkee ne contracto bi dëkkut ci biir réew mi bu boobaa di nga war a wàññi téeméer bu nekk fukka ak juróom lii mooy lempo bu ñu naan withholding tax on contract payment lii mooy lempo bi nga xam ne yow mi joxe contract warugal la nga wëlbatiku dem fay ko ci maakaani GRA tax office bu la gën a jege mbete ci banque yi GRA jagleel pour fay lempo war ngaa jébal lempo bi si diiri fukki fan ak juróom gannaaw bi nga wàññee ci xaalis si contract bi amul benn contracto bu ñu teggil fay lempo bi xanaa mu fekk ne nguuri Gambia ñoo ko jégale boole si projet yi nga xam ne mbootaay ndimbali ñoo koy dépense GRA di fayeku lempo ngir yokk.
For the first time in the history of the Gambia, Gambia Printing Publishing Corporation proudly introduces the Bibliomatic exercise book printing machine. The machine has the capacity to print more than 20,000 books per hour. Yes, 20,000 books per hour. It also prints magazines, newspapers, calendars, flyers, normal books and all kinds of printed documents plus items at affordable prices. With the Bibliomatic printing machine, GPPC can now render high-quality and non-size restricted printing service supply across the sub-region. Rush now and partner with GPPC for all your public and private printing service needs. Print with us today and you'd be offered highly professional, reliable and efficient service delivery by our team of experts. The Gambia Printing and Publishing Corporation is here to meet all demands and is reliable at all times. For more info, contact us on 437-4493 or 437-4402. GPPC is Gambian and it's yours.
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions. Enjoy Gamcel's internet broadband anytime, anywhere. Your national operator, Gamcel, Yaibara.
This season on Kerr Fatou. Fatou.
Hello and welcome to this special interview. Today with me I have Abdou Manjang. Abdou is a Gambian who is resident in the United States, and today we will be talking to Abdou we'll talk about himself, but we will also talk about the organization he's set up to help improve the healthcare sector in the Gambia. Abdou, welcome to this special interview.
Thank you for inviting me, Fatou Toure, and your colleagues, the entire Kerr Fatou, for hosting me here.
And first and foremost, tell us, who is Abdou, where you were born in, and what is your educational background?
Yes, thank you for that question. I'm from Dipakunda, the Gambia, not far from here. I was born and raised here, did my primary, middle school, and high school here. I'm a product of Serakunda Primary. Middle school, I went to Dow's Comprehensive Middle School, and high school, St. Augustine High. Mm-hmm. And right after that, I was fortunate enough, right in the second part of my high school, the second term, I got accepted in one of the community college in upstate New York. Mm. So basically, I was granted admission right before I completed high school. So right after high school, 3 months, I think, I traveled to the U.S. That was in 2005. I was a student at Niagara Community College in upstate New York, where I studied for 3+ years, then moved to Minnesota in 2009. Since then, that's where I reside with my family. I went to Metropolitan State University in St. Paul, that's the capital of Minnesota. I got my bachelor's degree in human services. The major was Human Services Administration, minor was Human Services. Then 2 years later, I pursued master's degree in Healthcare Administration at Minnesota State University, Moorhead, Minnesota. I graduated in 2021. But that has been my career, my education journey. But I also have some certification. I'm a certified Six Sigma green belt holder, and I'm also healthcare management, project management certified. And adding to that, I'm a ProSci change management practitioner. That's my educational background. But career, I'm a performance improvement advisor. What that entails is that coaching our organization's VPs and directors, looking at this process of our patient journey from the time of encountering with our staff all the way to the time of discharge of services. But I focus mainly on the surgical service line. That means we look at the time of scheduling, for instance, all the way the time a service is delivered to the patient, all the way to the time of discharge, how that entire process goes, and what are the gaps in that entire process, what are the opportunities, and what are the modifications that we can do or our care providers can do to help provide that exceptional patient care to our customers. So in a nutshell, that's what my role is about today. And that's
who you are as well.
That's who
Basically,
Abdou
that's
is.
Abdou Wahab.
Yes.
Now, I like to, when I talk to people like you, I like to bring this aspect. I was a migrant myself,
Yes.
and a lot of us, when we travel abroad, what we're thinking of is how to feed our families back
Yes.
home. Most of us, it's difficult to go to school. You know, you have to pay your school fees. It's expensive as a new migrant going to somewhere very new. How has the journey been like for you? What was your inspiration to going back to school?
That's an excellent question. To be honest, it wasn't an easy road. It was, it took me 16 years roughly, so from 2005 to 2020, 21. Right. So in that process, being an immigrant, especially the age that I went to the U.S., I was 19 years old,
Yeah.
right after high school. And with living in a city that I have no family, no relative, and also very few Gambians live in upstate New York. It was a challenge. But life is about determination and resilience.
Yeah.
That kept me going, constantly reflecting why I left the Gambia, sacrificed my siblings, caught up with my siblings, caught up with my parents. And unfortunately, some of those relatives that you left behind, you have no connection with them today. Some of them are gone, right?
Yeah.
So, but knowing I left the Gambia for education and the unforeseen circumstances happen in a lifespan. And if I happens to go back to the Gambia or come back to the Gambia without any degree, that's a failure. That's not a success.
Yeah.
And as a result, my mom and my dad, basically helped me the first year paying my tuition. But moving forward after that, it was me working 2 jobs to pay for my school. And credit to the organizations that I worked for, Alina Health, and that's the organization I work for still after 11 years.
Wow.
And I work for children's hospitals as well as a volunteer coordinator and a simulation operations specialist. So those organizations helped me pay for my tuition. They were paying 80% and I was paying the 20%, basically. So I held on 2 jobs roughly for 10 years, just able to pay for tuition because I know the price tag of education.
Yeah. No, and I think that I want to emphasize on this because it's important for us immigrants, including myself, because I still consider myself one, to understand that we can still do both, to go to school and also make a little money to support our families back home. How has that sacrifice affect your ability to be able to help people back home? And the second part of the question is, how is it, like a non-American, to be able to penetrate and work in corporate America?
Yeah. Well, families have to, education is a sacrifice that is not one person alone journey. It's a collective. If you look at it in terms of developing, development-wise, building houses or sending cars, I wasn't too into it. But also fortunate enough that from a family that don't give me that push. And as a result, I didn't, I send what I can, right, to help families as much as I can, but also knowing that I will be in a better position to help them if I get a professional job. And I can't get a professional job in the absence of degree, right? So today, alhamdulillah, thank God, I'm in a position where education has put me on a path where it's easy to help than if I didn't have education. And also, how can I contribute to the Gambia, right? Education will put me in that position.
Yeah.
And the second part of your question about
getting into corporate America?
Getting into corporate America wasn't an easy journey. I worked for an organization that for 10 years, it took me 10 years to get the opportunity where I sit with our organization VPs and directors and senior vice presidents. Today, I have an opportunity where from the CEO all the way to most of the directors knows who I am. That's because of education. And but I happens to have the latter part of my master's program was fortunate enough that the biggest hospital in our organization called Abbott Northwestern Hospital, our president gave me the opportunity to be a resident, an administrative resident under her, where I had access to all the senior leadership of the organization. Also have that direct connection with the leaders and participate in their daily operation. How do you run an organization of that magnitude, day-to-day operation, how it's from 7 a.m. or 8 a.m., start of the business day, all the way to the end. And that's allowed me to, expose myself, my potential, my skill set. And as a result, some of the senior VPs that I worked with and VPs, they gave me projects that I was the lead person of those projects. And also I took projects, if you add them, $3 million project. And those projects were all approved. And today, those projects achieve some of their goals. And seeing that skill set of me, the deliverable actions that I executed well, and as a result, 6 months into my residency program, I started getting job offers. But I didn't accept those offers because it was a 1-year contract. I was still navigating the system. Eventually, 10 months into it, I got another offer. So my manager at the time, who was the president of the biggest hospital that I was working as a resident, decided that I need to move on with a promotion because that's the opportunity that I can't bypass. And being a performance improvement advisor is something that has been my dream job. And as a result, I took that job, and today I love it. I have direct access to VPs and directors that I coach how to improve their processes within our healthcare system, so that we are capable of put in a position to provide that exceptional care to our patients and their loved ones.
Now, Mr. Manjang, you have been in the healthcare system for the past decade, right?
Yes,
And
yes.
plus, what would you say is your assessment of the Gambian healthcare system from somebody from afar?
From a distance,
Yeah.
right? I think that's one of the key things that motivated me to pursue a higher education in healthcare. From a distance, I never worked in the healthcare system in the Gambia. I never even worked in the Gambia while I was going to school.
Yeah.
But lack of resources has been a big deal for this country. And we have limited resources that our healthcare providers are given to provide that exceptional care. And our patients, our families, loved ones, expect to have a quality care when they visit our hospital system.
Yeah.
And unfortunately, there's a lot of gaps that we have, and there are rooms for improvement. Healthcare is not a one-person show. I always say that. When I was doing my master's program, I often preach that to my colleagues. It's a collective work, from the cleaner all the way to the docs, all the way to the admin staff. But here the problem is that resources, if we have, and it does not mean money, but the skill part of it, technology today, healthcare has advanced. There are virtual telehealth happening across the globe, but resources could be used effectively if there is transparency and accountability. In the sense, people who are given resources, how can they effectively utilize those resources to the best interest of the service delivery? And two, there should be an accountability. Every resources that is given, you want to know the A to Z of that resource. What is the output of that resources, so that you can better assess what direction do you want to take to help you deliver the exceptional care, because patient satisfaction is a key. If patient lose trust in the care delivery, hardly they will come and seek care, because trust is the piece, right? People who entrust you with their lives expect to receive better care. So I will encourage our healthcare professionals, our leaders in charge, to take healthcare as their priority above any other priorities. And government has to have a stake. In the US, for example, healthcare is a big campaign topic across the globe. Medicare, Medicaid, prescription. We always talk about universal healthcare because that's the big deal.
And these are the major talking points in campaigns. This is what drives people to the polls.
Yeah, because if without a better health services, you won't have a healthy nation. And a healthy nation means everyone has to be on the same page to receive healthcare as a human right. Therefore, people are equipped to deliver the service that they have with the resources that they are given, as well as patients seeking care would not hesitate to go to the hospitals and seek care. So I think there should be a balance. The government looking at how the private sector, the private hospitals are outperforming the public hospitals, and see what capacity can they provide to the public hospitals.
Now, I have seen some, diasporans coming in, like the Innovates Health, coming in and investing in healthcare and taking part. And I've always said we have so many skilled Gambians in the diaspora. How do you think the diaspora can help improve our healthcare system? We have a lot of people in the healthcare sectors across the world, and they're making big impact in these areas. How do you think they can help improve the services in this country?
Thank you for calling out Dr. Baji.
He's a good friend of ours.
Yes, he's a friend of mine. And I watched one of his clips where he says it's not about competition. It's about complementing effort to provide that care, right? So we have great Gambians in overseas who are in the healthcare field, nursing, pharmacists, anesthesiologists, but sometimes is the desire, right? They need someone who they can look up to. For example, I look Dr. Baji as someone to motivate me. How can I do the same to the folks in the country? It's not about the people that you provided care, but your loved ones. They go to those hospitals and seek help. And also, you were once a child in that country, and somebody else put an effort for the care that you received at one point.
Actually, his motivation, I don't want to cut it short. He said his mom is, I think, a diabetic or high blood pressure patient. And every time he was struggling to get the right medication for her, at some point they had to always take her to the United States. That was a motivation for him.
And similar, I have loved ones who died just for simple amputation. And I refused when they asked me, a suggestion. I told them I have no hope that she would make it. And eventually they had to do it, but it wasn't a successful outcome. And I have another relative who went through the same process. My dad, fortunately, he was lucky enough to afford to go to the US and the UK to seek treatment whenever needed, right? But how many Gambians have that opportunity? Very few. The only hospital system that I grew up using here is Kololi Clinic. How many at the time in the 90s, early 2000s, were able to afford to go there? So these are key things that I think it's high time for Gambians working in the healthcare field to sit back and reflect. When I was a child in the Gambia, there was someone at some point who contributed in the healthcare field, and as a result, I got the help that I needed. And today, how can I replicate that? How can I make an impact in the life of Gambians who I may not even know, right? So I think, and also we as Gambians living in the diaspora have to have that discussion, you know, what can we do to help our country?
Now, I know you have an organization that you founded, Impact Health the Gambia.
Yes.
Now, tell us about the organization and what inspired forming that organization.
Good. Impact Health, this has been my long dream, having not founding an organization, but the question was, how can I make a difference in the lives of Gambians?
Mm-hmm.
And it was a matter of when and how.
Mm-hmm.
And that motivated me to pursue Masters in Healthcare Administration. I know I may not be able to be a nurse in the Gambia,
Yeah.
but I can be effective in the administrative side. And I decided to pursue Masters in Healthcare Administration. And today, you know, in the long 10 years later, 11 years later, I decided to form this. And with the good help of some of the leaders that I have connection with in the corporate America setting. And Impact Health, why we name it Impact Health, right?
Impact
Someone
Health.
might ask a question,
Why
Impact
Impact
Health? Because go by the definition, the word impact is about making difference. Where do we see ourselves making difference? Is in the healthcare field. That's where we specialize. And that means we want to make difference in the lives of Gambians in the Gambia and in the public sector, not in the private sector. So all our services are geared towards public hospitals because that's where the need is most.
Yeah.
And we focus on 3 areas. A is to provide essential basic medical supplies. There is a foundation, an organization that we established a relationship with called MATTER. This organization is willing to help us with medical supplies, whatever supplies that our hospitals in the Gambia need. They will be able to see what they can help us with. And the second component is process improvement. Again, back to the impact of the cure that are delivered to the patients. So what can we do as, you know, performance improvement advisor?
Yeah.
What can I contribute to make a difference in the service delivery? That means working cohesively with the hospital system leadership team. And how can we engage the frontline workers into this process? And luckily I have 3 of my colleagues. One is a Gambian and 2 are Americans who joined me to help with this work. And the third component is mental health and addiction. It's rampant.
It is.
9 years ago when I was here, I saw some things that, you know, were not pleasant to see.
Yeah.
Teenagers into addiction and some with mental health issues. And that's part of our program, creating a pipeline where our clinical experts in the US will partner with the university, Tanka, any mental health and addiction services facility to give them that training, a new modern day of treating mental health and addiction. Instead of attaching stigma to it, but looking at it, this is a person who needs help. How can we help, right? Instead of labeling and institutionalizing the person, put him or her in a box. So these are the 3 areas of our focus, but the mental health and addiction, that's our 5-year plan.
Yeah.
However, it could be shorter than that based on the business plan. After I do my observation, then I will see how realistic we can execute that.
Now, what has been the relationship with government? You mentioned plans to work with hospital administrators. I mean, you will surely need to work with government as well. What is the initial step you have taken, if there is any, or do you have any existing relationship that you have established with the government?
Yes, Fatou, so far it has been positive experience, particularly the administrative lead at Carnifin General Hospital.
Yeah.
He and I first bumped to each other 4 or 5 years ago when he came to the U.S. For extension program training. He has the same master's degree in the program that I got.
Yeah.
And this brother is very engaged from day one. I approached him up to date. In fact, we started our connection was built from a debate about the Gambia healthcare service system. So, and we connected again, and he's very dedicated, and he connected me with the hospital lead at Bundung Edward Francis Hospital. Yesterday, we just went to Edward Francis Hospital, met with the leadership team, and donated some items there. They are engaged. They are committed to this initiative that we want to build. And last week also, I met with Dr. Bitey, the health director.
Services, yes.
And
he's a great friend of mine.
Yeah.
We always fight though.
Yes.
Yes.
I watched him at the brunch here when he came.
Yes,
and had
he doesn't come to
interview.
my show. He only goes to the brunch show.
Yes. Yeah. So he was very receptive to the idea as well.
Yes.
And another critical stakeholder is the Gambia Armed Forces. CDS, Yankuba Drame.
Yes.
Him and I had a conversation as well a few months ago.
Yeah.
And he definitely assured me that the medical supplies, there will be transparency and accountability. So, yeah.
Great, nice. That's interesting. Now, you just donated items to the healthcare system.
Yes.
Kerr Fatou was at the presentation. Tell us, how were you able to gather these items, and who are the beneficiaries?
Yes. Yeah. Some of the items, I purchased them out of pocket. And some of the items, I got those for free. But it's a pilot, not a whole lot.
Yeah.
If you look at it, what we want, our target is to ship a container. And we donated 40 boxes, 38 boxes. And those are our pilot. Depends on how it goes, because with my process improvement hat on, you want to test and see the outcome and go forward, right?
Yeah.
So those items, I got it from Marta, and we shipped them. I have a good friend of mine who got them from the container that we shipped them to, and we distributed them to Kanifing, Bundung, and Edward Francis Hospital. So our next target delivery will be crutches, beds, incubators, and warmers, where when babies are born, immediately put them in a warmer instead of just, because some babies are born with sepsis.
Yeah.
So we don't want that. Pediatric is a big deal for us. We want to make a dent in that space.
Now, I know I have seen a lot of organizations, I've seen a lot of people come up with these ideas, and they start doing this work. At some point, they get frustrated along the line.
Yes.
Now, how different is your organization compared to other organizations that we have seen in the country?
Yeah, I wouldn't say we are unique, but our playbook is different. We are approaching this initiative in 3 ways. Medical supplies, A.
Yeah.
B, performance improvement. And C, mental health and addiction. We know where we might have challenges will be the medical supplies, because financial involvement will be part of it, because as a 501c3 organization, a nonprofit organization, every dollar that the donor gives has to be accounted.
Yeah.
And we want the process to be transparent from A to Z. That piece needs a thoughtful process from A to Z. The second component we are coming is the process improvement.
Yeah.
Coaching these administrative leaders, and they coach their managers. The managers coach their supervisors and their frontline staff. Having that cycle of communication. If there is any health issues or safety concern, if it happens on the ward, like they call it here, on the ward,
Yeah.
by the next day, the leadership team has to know it. And within 24 hours or so, those who were engaged at the beginning of that safety issue, they are informed or given an update. This third component, the mental health and addiction. Training, engaging people from, at the early stage, how to treat mental health and addiction, and how the society can see it. And our target in the long term, if possible, will be how we can include mental health services in the healthcare system of the Gambia. This is, some people might say, wow, that can't happen because of the structure.
Yeah.
Well, it's a dream.
Yeah, it's
right?
a dream.
In the 60s, when Kennedy says we want to send man to the moon,
Yeah.
that time America, it wasn't realistic, right? But there were steps taken.
Myself, I was going to say, in the Gambia and the US, there's so much difference.
Yes.
And I know our people, it's going to take a lot of mindset changing, a lot of commitment, a lot of hard work to be able to inculcate that kind of discipline, especially when it comes to training people and making sure they deliver on what they're training. What do you expect from the ordinary health worker in the Gambia in order to be able to implement some of these things that you're saying?
Yeah, you're absolutely right. Change is not like flipping a switch.
Yeah.
It's a process. And that process means be patient and give the voice to folks who are doing the work. Empower the people who are engaged doing the work. For instance, if I'm the leader and I come and tell my employees, this is what I want you to do, there might be, some people might embrace it, but there might be a lot of resistance. In reverse, if they come and tell me, this is what we think we need to do to make our job less easy for us, to simplify it, it will be a lot easier to sustain that, to implement and sustain that compared to the boss telling them what to do. So our approach is empowering the folks who are doing the work, tell us what they want to see change in their process, and we support them, making sure their leadership team buy into that. So that's where we are different with other organizations, and we are committed for long term.
Yeah.
And that long term means we have to work according to the speed, right? The environment setting are different here compared to the US. So a lot of patients need to be exercised. And also looking at it in the lens of not telling people what to do, but coming with the curiosity mindset. Tell me, what do you want to do?
Yeah.
And I can support you. And that's what I told some of these stakeholders that I met so far. Tell me your process and I will see what we can do to help you.
To improve it.
Yes, rather than me coming, here you
This
go,
is it.
and I don't even know the structure,
So
right?
you don't know, you have been away for so long.
Yes,
and you
absolutely.
don't know the mindset. Well, that's interesting. That might be very helpful.
Yes.
Now, what is the long-term goal?
The long term,
Yeah.
go ahead, finish yours.
Yeah, what's the long-term goal?
So,
the plans.
Yes.
Where do you foresee this organization in 5 years?
In 5 years, I see Impact Health making an input or making a difference in all these major hospitals in this country. Banjul, Kanifing, and Bunun. These 3 hospitals for sure, we want them to have change management, lean concept in their process implemented. From their daily management system, their daily huddles where they gather the leadership team and all the way to the bottom, and help them have the scientific thinking concept. If a problem happens, how can I solve that? Going through that PDSA cycle, plan, do, study, act. How can I recognize this is a problem? And how can I solve this problem? And once we conquer these 3 major hospitals, there's a possibility we can conquer Bundung, Farafenye, Brikama. So once you hit those, the rest are rural hospitals, smaller hospitals. So in the next 5 years, for sure, we will be in a better position for our hospital system to have the scientific thinking model methodology, how to solve problems. And we want problems to be, to be addressed at a real time rather than waiting for whoever is in charge to come and solve that problem.
Now, finally, Abdou, your message to the healthcare providers in the Gambia, government, and of course, your donors.
Yeah. So what I will say, healthcare is not a one-person show.
Mm-hmm.
It's a collective work. And as someone who started working as a nursing assistant, what in the Gambia is called nurse attendant, I saw the output of collectiveness in healthcare field, from the person, like I said, from the janitor all the way to the doctors. And I want our healthcare providers to look at it in that form. This is not a one-person show, but collective work. And as a result, if we do that collectiveness, that teamwork, and dedicate ourselves to the mission that we are responsible to do, that's providing that exceptional care to patients and their loved ones, we put ourselves in a better position to deliver a high-level care that will meet patients' demand and their satisfaction. And we can't have that in the absence of not working collectively. And I will conclude by saying to Gambians living abroad, whatever skills that you have, either nursing or maybe IT, healthcare is moving fast. And all these skill sets that you have, you may think may not make a difference, but the little that you can provide, it can save someone's life. And saving one person's life, there's no price tag that you can put to that. So I will encourage everyone to collaborate and provide services that will make a difference in the lives of our loved ones in this country. Thank you. And thanks to Kerr Fatou and its viewers.
And thank you very much, Abdou, number one, for this brilliant initiative. I hope that Gambians will benefit from and learn from the experience that you have. And we also encourage a lot of Gambians who are in the diaspora, especially, who have these skill sets and have this knowledge to come back and impact in our society. Because in that only way, that is the only way we can help improve all different sectors in the country. You know, if we want a better healthcare service, we would need experts to come and help improve the sector. If we want better agriculture sector, we will need experts in those areas to help develop that area. And you volunteering and coming back home and leading to set up something that will help in that process is something that is very commendable. We want to thank you. And I hope very soon we will host you here again to talk about the big impact that Impact Health will be bringing to the people in our different communities.
For sure.
Thank you very much.
Thanks.
And to the viewers, good night to you all, and see you again very soon. Bye-bye.
Thanks.
Better and stronger as the sole ground operator at the Banjul International Airport. With an expansion in travel services, customers are assured of GIA's capacity to cater for all their travel needs, provided by professional, experienced, and ever-smiling staff. GIA's Hajj package and services, by far the best in the country, give the customers the opportunity for a memorable Hajj experience. For a more efficient cargo services, GIA means business as it launches its new multi-million-dollar ultra-modern cargo complex to revitalize and stimulate air transport. GIA, the pride of the Gambia.
Every day is a new opportunity to make sure our first impressions are always our best and to see possibilities on the horizon. To make our facilities and services more accessible and find freedom all around us. With a location proximity to active markets, with a liberal air transportation policy. That daily pursuit is how we turn everyday opportunities for you. For all destination marketing support, customized packages for new existing airlines and operators, and for a highly ranked tourist destination, the Gambia Civil Aviation Authority is here to serve. We regulate air transport, operate and manage BIA technical requirements, merged with commercial considerations. We have experienced and well-trained aviation professionals to cater for your needs. For investment opportunities in building airport hotels, shopping malls, playground for children, do contact us on 4472-831, 4472-893. Gambia Civil Aviation Authority. We go beyond daily.